Hello and welcome back to my channel. I am so exhausted. But it's been a long time. It's been too long. I have been traveling quite a bit. I'm currently away from home, as you can see in the lovely hotel room decor. I do not even have my handy dandy light ring, and I had to kind of fashion sort of lighting using the hotel lamps. So I hope that this this plan succeeds. Anyway, so I am in Washington, D.C. I am currently attending AACN Student Policy Summit. So the dean at accredited colleges of nursing across the country selects students to attend on behalf of their university. And so for South Carolina, it is me and one other student. I can't recall their name, and I won't even say that because I don't have permission to. So it's me and one other student. I believe they're an undergraduate student as well as our dean. And I also saw people from MUSC, the Medical University of South Carolina. And I believe Clemson is supposed to be here, as well as Columbia International University. So we are meeting with our senators, Senator Graham and Senator Scott tomorrow, as well as Congressman Clyburn. So I know one of our asks is coming up this week, and then I don't recall when the others will be under consideration, but we are at the start of the budget and appropriations process. For those who are not familiar, the president always submits their budget. Well, I say always very loosely. I can explain that another time. Submits their budget to Congress the second Monday in February. The Congressional Budget Office before that submits their budget, what they think, to the president. And then Congress doesn't really have to consider any of this, by the way. So before we get to like a 302A, 302B, meaning authorized spending, then appropriations spending, and so thus the budget and appropriations process. So budget is kind of what's authorized to spend, and then we appropriate some of those authorizations to fund programs. So similar to, for example, my program is being paid for by a HRSA line item, the Health Resources and Services Administration. So if I haven't mentioned that before, but it does come with service obligations once I complete my program. But so I wasn't coming in to check in about AACN, but that's why the hotel room, that's why I have been traveling a lot in the nation's capital, back on my old stomping grounds. But y'all know I'm currently in South Carolina. Go Gamecocks. We're in the midst of March Madness. Yeah, Dawn's my girl. We're number one. So I just got back from the Netherlands last week after studying abroad there for about a week and a half. This episode is actually supposed to be all about nursing in the Netherlands, so not AACN Policy Summit. Is going to talk about that a little bit later. Maybe not. I don't know. Y'all know policy's my jam, but like I said, I'm tired and it is late, and we're going to Capitol Hill tomorrow, or very early first thing. So just in sum, and I'll kind of try to remember to put links to everything in the comments, as well as the caption below. I'm trying to get better at that. I definitely will link to the video of the hospital center we toured, and that is what I was actually looking up before I turn this on. I'm not techie. I don't do all the fancy editing, so y'all get what y'all get. I've told y'all that before. I gotta look it up. But while I'm looking that up, so we left, I think it was maybe 9 students or so and 3 faculty members. So one was the guest faculty from the College of Nursing, and two were actually over the it was like special topics in like international nursing and healthcare, something like that. It's a 500 level course that I enrolled in for the study abroad. And so it was 2 faculty for that. And then the guest faculty, she's actually on the global nursing committee. And so we landed in the Netherlands. And I think one of the coolest things that, even though that's not why we were there, but we stayed at a student ran hotel. I plan to visit the Netherlands again, and it is a place that I would stay again. You can tell how much they care, how much they're learning. It was amazing. Their restaurant was amazing. I'm planning to I'm making a StoryMap. I'm still in the process of finishing that. And if you've never seen or heard about StoryMap before, you're gonna love it. Because you can actually plot like geographic mapping points, add pictures and narrative, and it just kind of lets it kind of tell the story. So combines different ways of like learning and absorbing information. But I'm piecing together a story map that'll go into more details about the trip. So I'll be sure to post that link below. But one of the things I liked is that they had Le Début, was the restaurant there, again ran by a chef and students who are in like their training program. So I really, really loved our experience there in the hotel. And each room in the hotel is designed after a different hotel brand or chain, so the students can learn about that. So I thought that was very fascinating. So I just wanted to give a shout out to Scotel because they were amazing. And I studied abroad in Holland University of Applied Sciences. And so it was a phenomenal program. Our host was Hans Springer and his wife Louise. Very, very heartwarming people, just very warm and welcoming. And I loved it there. We ate dinner at their house on our last night there. We did karaoke, got to sing Thriller and Lauryn Hill. We even sang Coolio. We had a good time doing karaoke. I love me some karaoke, so that was fun. The other thing, at Holland University, we did get to hear some lectures from Hans' colleagues, one of them being Kramer. She was a nurse practitioner, and so they do master's level there. And her lecture focused on documentation. And so I really, really love the emphasis, because y'all know in nursing school, everything's about charting. And I mean, I think I saw a meme right after that lecture that was talking about like do documentation as if like it's being read in a courtroom, like an attorney's going through it for a case. And I'm like, it's so true. And it's not just about covering your butt, it's about patient safety too. And so she emphasized the importance of it for like safe patient transfers and handoffs where it's maybe they're going to a different unit within the same hospital. So maybe not a transfer to another hospital or anything like that, but even within the same hospital, that it's very, very important. It kind of tells the story. And it also, a concept she mentioned that I had never heard of before was cognitive forcing, and that writing it down like forces you to retrieve and kind of retain as you're going through the pathophysiology of the process, as well as the pharmacotherapies that you're doing with that patient. It does cognitive force and kind of reinforces like your knowledge base and like newer knowledge. So I thought that was a really important point that I hadn't thought of before regarding documentation. And then the other thing I wanted to mention to y'all was we went to Amsterdam University Medical Center. So Amsterdam UMC, and Michael Oliver R. I'm not going to try to pronounce his last name, but Dr. R, he was a clinical pharmacist. And so he's a physician, but his expertise is in clinical pharmacology. So I thought that was really, really cool. And they mentioned the different pathways to pharmacology, like on their team, they have a lot of nurses as well as physicians, as well as pharmacists. So I thought that was really neat. And one of the awesome things they had there going on was a student-led clinic between the Netherlands, Spain, and Italy. And so I thought that was really, really cool. And we got to do some case studies with them. So that was just fascinating. And so it's something that I would love to see implemented at the University of South Carolina, especially as we're like building a new center in partnership with Lexington Medical Center. And so I think it would be a great thing, especially for the master's entry students like me, for us to do a student-led clinic. And so they only see 4 patients a day. So before anybody's like, no, don't add on to the things that students have to do. I think it's a phenomenal, innovative like learning model. And I'm actually in the process of reading some more about his research and yeah, seeing if it's something that we can implement stateside, and also figure out some type of partnership maybe with other universities in different states across the country, because y'all know states, going back about policy, states are kind of like little incubators. They're like little laboratories. And so if you met any health policy person before, a lot of us talk about state health policy in that way because it's how it functions. So scope of practicing, licensing laws. I've actually drafted amendments regarding practicing at the state level when I worked on Capitol Hill 10 years ago. And so it's fascinating to think about how states function like little laboratories, kind of testing out different policies. And so I think it would be cool to partner with other states, colleges of nursing, other states, to do like a student-led clinic type initiative and kind of see what works, what doesn't work, compare best practices and policies and things like that. So I think it is something that we could implement stateside. Of course, like I said, I'm reading up on the research and I don't recall how long their student-run clinics have been going on. But yeah, shout out to Dr. Michael Oliver, and I might link his dissertation below on pharmacovigilance. It's really cool, the work they're doing. And pharmacovigilance isn't just about, AMR, like antimicrobial resistance, and like how we prescribe and use antibiotics to treat things, and, communicating like the science and like what patients need to do. It's, beyond that. So just wanted to mention him really quick because I thought that was very innovative. And then finally, all the vegan food was amazing. Y'all know I'm vegan, and it was so easy. It was just like woven throughout the experience. They made like the healthiest choice, the available choice, the thing that was there. Like in the States, there's like soda and candies and everything by the checkouts. Like by the checkouts there, I mean, they do have a lot of croissants and a lot of maybe pastries and things like that. But I thought it was unique that they also had a lot of fresh foods and salads and like fresh squeezed juices and things like that. And you saw maybe candy aisles at like larger grocery stores, but I don't recall in like the smaller like to-go marts. I can't think of the name of the mart right now, even though we went there several times. It was clutch. It was so clutch. I brought back so much food. And it didn't help that Hans and Louise like bought me like vegan naan. They bought me like vegan stroop waffles. I brought back, marshmallows. I brought back like chocolate to make s'mores with my boys. They've been asking for a while. Some crackers, stroop, the stuff that you like spread like jam. Just amazing, amazing, amazing. The last place that we went there was like a cancer center in Amsterdam. Was it a part of VU? I think VU and Amsterdam UMC combined, I believe they mentioned. So I do have a lot of stuff like with, do I have my pencil case? Let's see. I do have, oh my gosh, my setup is gonna collapse. Okay, bear with me. Yes, I do have my pencil case. Look at that. So that's the VU. That is the university where we went to get a lot of stuff. Y'all, the pencils, I like really cool pencils and stuff. So I probably went a little crazy and got like little cute sparkly. Look at that rainbow. I think this one, this was from Van Gogh. So you can see Van Gogh Museum, Amsterdam. So that one was from there. Oh, how cool. Just neat little pencils. I think, did I get any of them that say Holland on them? I know I got my colleague some pencils. So he's a pencil connoisseur. Another from the Van Gogh. How neat is that? Look at that little green Van Gogh Museum. I just thought that was so cute. Oh, how cute. These little ones say, "Don't worry, be happy." Little bunny. Don't worry, be happy. Yeah. So I believe VU combined with Amsterdam UMC. So I thought that was very neat. And then the last place we visited, oh goodness, where it's not, I think that's not the right one. It wasn't the VU Cancer Center place. It was like a specific hospital that was just, I think it's like the Netherlands Cancer Institute. It's named for the father of microbiology, Anthony van Leeuwenhoek. I'm not sure if I said that correctly, but yes, he has like the little, look at that little wig. Can you even see that? Anthony van, not sure if you can even see that, but yeah, he has like a little dope wig. And they may even have like a little about thing, which is pretty cool. But yeah, so we visited there, and would you believe it? There was like signs of like the nurses being like on strike for better pay, which was kind of sad because it's like, man, that's happening even across the country. And it actually says, we are the Netherlands Cancer Institute. The NKI is one of the top 10 comprehensive cancer centers in Europe. By combining cancer care and research and facilitating the exchange of knowledge, we try to find a cure for every cancer. I mean, I'm gonna link their YouTube video because it was amazing to actually watch. And so, yeah, I'll link that below. You can tell it was shot like one of those like fancy drones, but yeah. So, and I will say for not just their cancer hospital, for all of their like hospital centers, their research area, their student areas at VU and Amsterdam UMC, and in Holland, University of Applied Sciences, there was green everywhere. There was plants everywhere. Oh man. So I'm going to put a lot of that in my story map because it was just like one of the main things I took away was how student-led and patient-centered everything was, and it made the difference. And so it was just like that little attention to detail that I found just fascinating, and you could see a difference in their health outcomes. One of the other things I learned was that they have 27 different types of health insurance, which I just thought was like, wow. And they don't deny based on pre-existing conditions, but each of the different plans offer like little different incentives, mainly like prescription drug coverage, and kind of similar to here a little bit, the services that they cover. So like specialty care kinds of things, like what's considered like cosmetic versus like needing glasses and being like visually impaired, things like that. So that was kind of cool to learn about as well. Yes, I think I covered all of the healthcare centers and the lectures and things that stood out. I mentioned the food, our hotel, everybody biked everywhere. It really is the city of bikes. Amsterdam is city of bikes. Bikes everywhere. Many of us almost got hit. I want to say almost everybody almost got hit by a bike. We went to Ice Bar. That was fun with the like Pirates theme. It was really cold, but you couldn't feel it. And there was like this nutty vodka. So good. So I'll make sure I'll link Ice Bar and give them a shout out because we had a lot of fun there. Went to Body World. Oh my God, if you haven't been, I forgot the way they preserve their actual human remains. And of course the identities it's de-identified. Oh my gosh. It was phenomenal to see how they position the bodies. I took lots of pictures. Again, that'll be my story map, so I'll make sure I link that once that's ready to go. And we visited the Anne Frank house as well. Did not realize they spent so much time in Amsterdam. We did get to go to Haarlem and Almere. I believe those are the other two cities we went to, which I didn't realize Haarlem was the same Haarlem as in New York over here. Really cool. Went to Rijksmuseum. We did a Love Canal cruise, and I already mentioned Body World. Only thing I didn't get to do was go to the Nemo Science Museum. I was kind of sad about that, especially because I wanted to get my oldest son a prism. He asked me to bring him back a rainbow. So I did a rainbow theme, colorful theme of things. Amsterdam is also very LGBT friendly. The flags were everywhere outside of hospitals. There was even like one little like booth that was like stop and ask me about gay, or like gay resource center, LGBT center, which I thought was really cool. And there's like a lot of rainbows like everywhere, like rainbow benches, and it's like kind of woven throughout society there. So they're very open. And because I know someone's gonna ask me Yes, Amsterdam is known for marijuana and edibles and smoking and things like that, as well as the red light district. I think people that came with me, students that came, they did get to visit the museum. I was just wiped, I think, by the time the opportunity came to go visit the red light district, so I did not go. And I won't confirm or deny marijuana usage, but yeah, it is available there in Amsterdam. So yeah, we had a great time overall. Our host family and the lecturers, I am looking very much forward to staying in touch with them and building partnerships and future collaborations. Yeah, it was just a fun time, and I'm just happy to check back in with y'all. So I am alive and well. I know it's been a few months. I think I'm maintaining my excellent academic status. Yeah, so currently, I think holding on. I have 2 A's this semester and 2 B pluses so far. And you probably know what classes those 2 B pluses are in. But they're high B pluses, like borderline A's. So everything's going very well. I'm looking forward to finishing the semester and starting my mother, baby, and peds rotations this summer. So that's gonna be interesting because y'all know I don't want to do nothing with mother, baby, or peds. So, but I'm always telling myself that everything's an opportunity to learn and broaden my knowledge and just allow me to better advocate for people and take care of patients. So yeah, so that's what's been going on. And y'all know I always mention my hair and nails. Wasn't really feeling the shape. He didn't get my coffin right, but you know, these are like the sparklies. You don't see the sparklies. Yeah, y'all see how that shape and it's not quite smooth. It was a new tech that I don't usually go to, but it was my same salon, but it is what it is. And then my girl, Andrea at DNR Hair Studio, the only person allowed to touch my scalp in the multiverse. So, yep, silk pressing it up. This is a few days late and it did rain here. Yeah, so, yeah, because I usually catch my hair curly, but yeah. Here she is, straightened. I got a much needed haircut after, it's been since June of 2022 since I had my haircut. So you can see, nice cut, nice volume. I think she looks good. Yeah, so it's all my hair, y'all. So y'all know it's just always curly. But I just always had to give DNR a shout out, and yeah, I'm not telling you about my nail salon because whatever, but yeah. Questions, comments below. Yeah, I'm about to go to bed and I'll remember to put all those links in. So, peace. Thank you for tuning in.